students. Now we can see MCQ of community health. In previous class we have discussed up to 50 questions from this slide share. Now let us discuss next question of it. Okay, here you can see the question. Up to 25 questions. Up to 25 questions we have discussed. Now we can see the 26th question. Then 26th question. Infancy period is 0 to 1 year, 6 days to 1 year, after 1 year. Infancy period is 0 to 1 year, 6 days to 1 year, after 1 year. The answer is 0 to 1 year. Then constructive organism of typhoid fever. Constructive organism of typhoid fever. Vibrio cholerae, Salmonella typhi, Clostridium botulinum. Vibrio cholerae, Salmonella typhi, Clostridium botulinum. The answer is Salmonella typhi. The next question. Drug of choice for typhoid fever. Drug of choice for typhoid fever. Chloroquine, chloramphenicol, tetracycline. The answer is chloramphenicol is the drug of choice for typhoid fever. The next question. Next question. Next question. Reproductive child health program was launched on. Reproductive child health program was launched on 1960 April, 1977 October, 1950 May 1950. And the answer is October 1997. Okay. The next question. The most common complication of intrauterine device insertion is. The most common complication of intrauterine device insertion is bleeding, pain, sterility. The answer is bleeding. The next question. The basic unit of system of Panchayat Raj is. The basic unit of system of Panchayat Raj is Jilla Parishad, Grama Sabha, Nyaya Panchayat. Jilla Parishad, Grama Sabha, Nyaya Panchayat. The answer is Grama Sabha. The next question. World Health Day is observed on. World Health Day is observed on April 7th, 1st April, 9th April. The answer is 7th April. The next question. The most peripheral healthcare facility. The most peripheral healthcare facility, sub-center, primary health center, community health center. And the answer is sub-center is the most peripheral healthcare facility. The next question. The biggest problem faced by our country. The biggest problem faced by our country. Nutrition problem, population problem, economic problem. The biggest problem faced by our country is population problem. Then the novel method of health education. The novel method of health education, panel discussion, lecture method, socio-drama. The answer is panel discussion. The next question. The mid-arm circumference of well-nourished children between 1 to 5 years of age. The mid-arm circumference of well-nourished children between 1 to 5 years of age. 10 to 15 centimeter, 16 to 7 centimeter, 18 to 20 centimeter. The answer is 16 to 7 centimeter is the mid-arm circumference of well-nourished children between 1 to 5 years of age. The next question, World AIDS Day. World AIDS Day. 1st December, 31st December, 1st November. And the answer is 1st December. Then temporary hardness of water is also called sodium hardness, carbonate hardness, chloride hardness. The answer is carbonate hardness. Temporary hardness of water is also called carbonate hardness. Then next, final step in purification of water. Final step in purification of water. Filtration, addition of lime, and chlorination. Final step in purification of water. The answer is chlorination. The next one, the nucleus of health service in rural area. The nucleus of health service in rural area, community health center, primary health center, sub-center. The answer is primary health center. The next, MTP Act, Medical Termination of Pregnancy Act, came into force on 1961, 1971, 1972. The answer is 1972. The next one, ultimate objective of MCH services. Ultimate objective of MCH services, lifelong health, reduction of IMR, reduction of MMR. The answer is lifelong health. The next, National Gynoworm Eradication Program. Gynoworm Eradication Program was launched on 1984, 1974, 1964. The answer is 1984. The next one, backbone of MCH services is backbone of MCH, home visiting, PHC health service, home visiting. Then constructive agent of botulism. Constructive agent of botulism, Brotidella, Clostridium botulinum, Clostridium. The answer is Clostridium botulinum. Next, tuberculin test was discovered by Clemens von Perquet, Louis Pasteur, Edwin Jenner. The answer is Clemens. The next one, vaccine against TB is tetanus, BCG vaccine, MMR vaccine. The answer is BCG vaccine. The next question, incubation period of TB. 5 to 15 days, 3 to 6 weeks, 15 to 30 days. The answer is 3 to 6 weeks. Then the final step in TB control program is early detection of sputum positive cases, chest X-ray, distribution of anti-TB drugs. The answer is early detection of sputum positive. The next one, route of administration of streptomycin against TB. Route of administering streptomycin against TB. Subcutaneous, deep intramuscular, intravenous. The answer is deep intramuscular. So once we recall all MCQ, right. Infancy period is 0 to 1 year called infancy period. Then Salmonella typhi is a causative organism of typhoid fever. Then drug of choice for typhoid fever is chloramphenicol. Then 1977 October, reproductive child health program was launched. And next one, bleeding is the most common complication of IUD insertion, intrauterine device insertion. Then Grama Sabha is the basic unit of system of Panchayati Raj. The next, 7th April celebrated has World Health Day. And next one, subcenter is the most peripheral healthcare facility. Then population problem is the biggest problem faced by our country. Then next, panel discussion is a novel method of health education. The next one, 6 to 7 centimeter is the mid-arm circumference of well-nourished children between 1 to 5 years of age. Then World Health Day, December 1st, World Health Day is declared. The next one, carbonate hardness. Temporary hardness of water is also called carbonate hardness. The next one, chlorination is the final step of purification of water. Then the nucleus of health service in rural areas, primary health center. Then 1972, MTP Act came into force. The next one, the ultimate object of MCS services, lifelong health. The next one, 1984, National Guanyi Worm eradication program launched. The next one, backbone of MCH services, home visiting. The next one, Clostridium botulinum is a causative agent of botulism. The next one, Clemens discovered tuberculin test. Then vaccine against TB is BCG vaccine. Incubation period of TB is 3 to 6 weeks. Final step in TB control program is early detection of sputum positive cases. Then route of administering septomycin against TB is deep IM. Thank you all.